Hey guys, welcome back to my channel. It has been quite the journey for my senior semester, y'all. I'm so excited. So let me give y'all a little spill. So for my preceptorship, I actually am in PEDS. And when I tell you, I have seen so much and it's amazing. A little bit, at first I was a little intimidated, but it has grown so much on me. And like, I'm still saying NICU is my first, but if NICU does not plan out when I graduate to get a job accepted in that specialty, I will definitely go for PZR because you see so much and it's so interesting. So for my preceptorship, we are required to get 140 hours, and today is March 20th. And y'all, guess what? Your girl only has 12 hours left to complete. So next Saturday, March 26th, I will be completing my last day of my preceptorship. So when I tell y'all I have seen a lot, I have seen pediatrics and DKA. I have seen pediatrics with many injuries, whether it's leg injuries or arm deformities due to an injury like falling off the trampoline. They had a patient today, he was going to have to go to surgery to get his bones reduced. It was a closed reduction though. So he was doing pretty good. He was handling the pain really well. The only thing he received at first was the Versed before he got the x-rays, and after that they gave him morphine. But pretty interesting. I have been able to do IV pushes, IV piggybacks on these pediatric patients. I have done IVs, catheters, and when I say catheters, I have the youngest was 10 days old, and like the oldest child I have cath was like 8 months. So a lot of different experience, and especially among the age groups, male and female. Some other cool things I have gotten to see was I was able to see a patient get a PICC line put in, and he was only 5 days old, so that was pretty cool too. Being in there and having to get sterile, gowned up and everything just to see the procedure get done. And that was in the NICU, which I was able to go upstairs to see that. Even though I'm in pediatrics ER, they needed a nurse to go with the ultrasound equipment to find a vein. So that was pretty cool. I'm trying to think what else, y'all, because I've seen a lot. I've seen a lot of critical and trauma patients. I have seen patients that have been ejected by the car. I've seen patients with gunshot wounds. I have seen patients with animal bites, and not just like a small animal bite. An animal bite that requires like 10 plus stitches. There was one child that had got bit in the face. They had to get stitches in their face. I have seen head lacerations from a child falling and hitting their head and not losing consciousness. I have also seen, trying to think, y'all, give me 1 second because it's just a lot. Trying to think of something pretty cool. But anyways, I'll get back to it when I think about it. So yeah, doing IV pushes is pretty cool, and especially when you're given antibiotics, you have to be really precise on your calculations. You have to calculate when you're in pediatrics. You know, the doctors order a certain med, you want to make sure based on their weight that it's safe, it's a safe dose. And as well, when you go to the Pyxis and you pull in these medications and you have certain meds to mix, you have to make sure you're pulling up the correct amount to give to those patients. I have also placed EKG leads on a child, so it's pretty much the same as an adult. So it's pretty cool. Like, a lot of the doctors, when they have patients that's having vomiting and or diarrhea and fever and stuff, they appeal challenge them before they allow them to go home. So depending on the age group, they might receive a popsicle or some Gatorade, or, you know, if mom was breastfeeding, they get breastfed. or they formula fed to get that. So they just want to make sure they don't have any difficulty swallowing and aspirating, and they're actually able to keep in the liquids that they're receiving. Something cool today that I saw was a 4-day-old baby. He had only one bowel movement, and that bowel movement was in the hospital the day of birth. And he came in and he hadn't urinated in 24 hours. So his sugar was pretty low, but it's pretty like a norm for children. Mama letdown was, and when I'm talking about letdown, I'm talking about like the breast milk had just started actually making a sufficient amount today when they got admitted. So mom complained about the constipation and stuff like that. So he actually got admitted because he needed fluids. His CO2 was low and his potassium was low. So they just wanted to, monitor him and, get his blood glucose up as well before he can go home. So y'all, I have seen a lot, and I'm going to do another detailed video about my PEDS ER preceptorship, but because I have been going absolutely too long from y'all, I was like, let me record this real quick because I have been absolutely busy. I'm going to school every Friday from 8 to 4:30, and that's my adult class as well as my simulation course. And then I normally go to work every Tuesday, Wednesday, Thursday, and that's 12-hour shifts. Sometimes they're 14-hour shifts depending on the day. And then Mondays is like my only day to relax. And when I say relaxing is not relaxing. It's studying, meal prepping, running errands, and like whatever else craziness that might happens. And that becomes my day. So it's not really an off day. So I have been so exhausted, but I feel so bad for neglecting you guys. So right now in my course, in my adult 3 course, we're covering cardiac critical care. So cardiac is a lot, y'all. It is a lot. It's intimidating reading these strips and knowing the different AV blocks, the PECs, PACs too. If I'm not mistaken, y'all, I gotta brush up on that because it's a lot. Normal sinus, tachy-sinus, like it's a lot. So I will definitely be giving y'all another more detailed video about my PEDS experience. I just wanted to give y'all a little something because it's been way too long. But if you guys are graduating this semester, definitely drop a comment, or whatever semester you're in, drop a comment. Let me know what courses you're taking and how's your semesters going. I would love to hear from y'all. And look, the goal is still 500 subscribers. I think we're at like 358 right now. So I'm trying to get that number to go up, y'all. Look, I'm trying to give y'all some more material because I definitely want to do a giveaway. So once I hit that 500 subscribers, I will be doing a giveaway. Thanks for tuning in, y'all.